Hello, Kentucky. Hello, Virginia. It is 4 o'clock on Monday, a time we come together until we fully beat this virus and remember that we're going to get through this, and we're going to get through this together. A lot to go over today, primarily good news. Let's start with the good news of the day. We're going to start with a project announcement on Eberspecher, North America. We announced a great project today for Jefferson County as we work to build back our economy to pre-pandemic levels and beyond. Eberspecher, North America is moving forward with plans for a new facility that will create 214 high-quality jobs for the greater Louisville area. Eberspecher manufactures exhaust technology and climate control and acoustic systems for automotive customers around the globe. This German-owned company is increasing production for North American customers with its 7th U.S. facility, but the very first in our Commonwealth of Kentucky. The company's built a strong reputation over the past 150 years, and I'm proud its leadership has selected our great state to grow its company. Eberspecher's products help improve air quality and reduce traffic noise. The new facility will allow the company to increase its focus on environmental protection, safety, and comfort across its products. The new operation will occupy nearly half of an existing 300,000 square foot facility in the Louisville Riverport area. The project's expected to get underway in the coming weeks and is scheduled to be completed this August. You've heard me talk about it before, but our state's automotive industry is second to none in terms of quality and diversity. Even more impressive has been the industry's resilience in the face of all the challenges that we've seen. The sector continues to move ahead with an eye on the future, and our supplier base grows stronger with every expansion and every new location announcement. Thank you to the leadership of Eberspecher for their decision to locate in Kentucky, and congratulations on this major step. This is just the latest in a long line of good job announcements that continue to grow and build our momentum. And the more calls that keep coming in, the more I see us having an opportunity for a bigger, brighter future where companies that weren't previously looking at Kentucky not only are, but they are very interested. Where places like the New York and LA, their density is no longer attractive. In almost every one of these calls, they mention how this state, how we as a people have responded to COVID, and the fact that that makes them feel comfortable coming to a place like Kentucky. Next, today we have good news for 41 Kentucky communities. I'm excited to announce more than $4.3 million from the Land and Water Conservation Fund is going to go to improve parks and recreational spaces across this Commonwealth. LWCF is a federal program designed to protect important natural areas, help local communities acquire land for outdoor recreation spaces, and develop or renovate public outdoor recreation spaces. Parks and recreation spaces are an important part of every single Kentucky community. It's where we take our kids. It's where our families come together. They provide safe spaces for exercise, community building, and leisure, all of which are important to keep us healthy and happy. This is a crucial piece of building a better Kentucky for every family. All right, there are a lot of communities that are getting parts of these grants. So here we go, Virginia. Ashland, Auburn, Barberville, Benton, Burnside, Columbia, Cynthiana, Danville, Drakesboro, Eddyville, Edmonton, Elizabethtown, Flatwoods, Hazard, Hopkinsville, Horse Cave, Catawba, Lancaster, Lawrenceburg, London, Middlesboro, which has dealt with some flooding the last couple days, Middletown, Munfordville, Murray and Callaway County combined, Nortonville, Raceland, Ravenna, Winchester, Carlisle County, Carroll County, Christian County, and the counties of Floyd, Greene, Livingston, Menifee, Monroe, Morgan, Shelby, Spencer, Todd, and Trigg. Selected applicants must undergo federal review and receive approval from the National Park Service before being selected for this funding. Congratulations to all of them. The building of our parks, the improvements of those opportunities only make us more attractive for new business and only improves our quality of life. Next piece. Education is and always will be one of the top priorities for my administration. So today I'm pleased to share some good news for Kentucky students who rely on financial aid to help pay for college or technical training. Beginning this fall, Kentucky students will have access to more financial assistance from the Kentucky Higher Education Assistance Authority, as the maximum award for the College Access Program, or CAP grants, is being increased. That is big news. CAP grants provide need-based assistance to eligible Kentucky undergraduate students. For 2021-22, CAP grants will offer students up to $2,900 at eligible four-year institutions and up to $2,200 at the state-eligible community and technical colleges. This increase in grant funds is possible thanks to a combination of more state funding and a changing applicant population. These boosted CAP funds, coupled with federal Pell Grants, which are also increased for 2020 to $6,495, will mean many students can get all, I repeat, all of their college expense paid. There's going to be more money available to our students here in Kentucky than ever before. These increased need-based grants will help make the dream of higher education an affordable possibility for many who otherwise did not believe it would be possible for them. With the service and commitment from agencies such as KHEAA and the Council on Post-Secondary Education, our citizens can achieve their educational goals while helping make Kentucky more competitive in today's global economy. Find out more at kheaa.com, and a great announcement, because you shouldn't have to be paying off a college loan for 30 years after you graduate. This is an opportunity to get more of that paid for, so go out, get your higher education. All right, another piece of good news was an event this Saturday. So on Saturday, I was proud to join pastors representing more than 50 congregations and leaders with U of L Health for a one-day, 12-hour event to vaccinate close to 2,500 people in West Louisville. Our health care providers throughout the Commonwealth, including U of L Health, have been great partners as we take vaccinations into the community, making sure every Kentuckian gets their opportunity at a shot of hope. Our healthcare heroes and volunteers spent their Saturday ensuring those who are willing could get vaccinated. Some of them have volunteered weekend after weekend as we all work to vaccinate as many Kentuckians as quickly as possible. Thank you, and thank you to our faith leaders who are also leading the way in getting vaccinated and educating their communities and their congregations about the safety and effectiveness. U of L Health selected the Kentucky Center for African American Heritage for the event, specifically for its location in West Louisville, which is a federally designated medically underserved area. As CEO Tom Miller said Saturday, transportation, communication, and online registration should not be a barrier. Our churches have been invaluable partners in breaking down those barriers, and while there are many to thank for this event, Pastor Reverend David Snarden spoke to begin and appreciate his leadership and the leadership of so many more. All right, also on good news and on vaccines, a reminder, Kentuckians age 40 and up can sign up for vaccine appointments. That started today. We're going to talk in a minute about places where vaccinations are open. So if you are 40 and up and you haven't gotten vaccinated yet, I will bet that if you try, you can get an appointment in the next week and a half. Just think about that. You've waited a long time, and now is the chance for as many of our folks in that population, 40 and up, to get vaccinated. Here are 4 places that have hundreds, if not up to 1,000 open appointments that you can go to right now. For the first time, we have Louisville and Lexington and Frankfort on this list. Norton Healthcare, which you can sign up at nortonhealthcare.com, has openings right now. If you're in Louisville, 40 and up, anything in 1C, 1B, you can sign up right now and get your shot of hope. There are openings in Louisville, which I know has had some of the largest groups that want the vaccine and that have waited patiently. Sign up. Lexington, too. And remember, you don't have to live in either of these counties to sign up. If you are anywhere in the area close to Louisville or Lexington or Frankfort, this is your opportunity. ukhealthcare.uky.edu/COVID-19/vaccine. You can sign up there. The Kroger Frankfurt Clinic that runs in the first part of the week. Get online and check it. They have some openings. And finally, King's Daughter Pavilion in Greenup County, also close to 1,000 openings right now. So if you are in that area, boy, you can sign up. You can get in there fast. You can get your shot of hope, and you can get on your way to being vaccinated. And here's a couple of reasons why it's so important. Number one, the positive. Today, the U.S. Center for Disease Control and Prevention released a study that found 2 of the vaccines being deployed are highly effective in preventing infections among frontline workers, those exposed more than anybody else. The CDC studied 4,000 frontline workers, including healthcare workers, police, firefighters, and others. The CDC studied the effectiveness of the Pfizer and Moderna vaccines. The CDC found reduced risks of infection by 80% just after the first dose. In other words, don't wait for J&J. After just your first dose of these 2, you can already get to 80%. But the CDC found, again, amongst those that are exposed the most, that the protection increased to 90% after the second dose of vaccines. That's everything from the studies before we started doing the injections is now proven amongst those that, again, are exposed the most. The study is important because it is done in real life. So there are vaccine appointments available, and real life studies have shown just how effective, life-changing, and life-saving they can be. That's the positive. Next, let's talk about the negative, the variants. We have to get enough people vaccinated before this thing mutates further and before the B.1.1.7, that's the UK variant, becomes the dominant strain in Kentucky because it spreads faster. This is a race, and therefore we need people willing to go in and get the vaccine as soon as possible. We've got Dr. Stack with us today for 2 separate updates when we get to them. The first one, though, is he's got an update on the total number of the B.1.1.7 variants found in Kentucky. Dr. Stack.
Thank you, Governor. Good afternoon, Virginia, and good afternoon, Kentucky. So on the variants, remember we sequence a subset, a small portion of the total number of positive tests that we get. And there's attention to this at the federal government and also at the state government about do we grow that and how we grow it so we can sequence more of the positive tests. But that's a process that we'll work on in the months ahead as the nation as a whole works on increasing our surveillance capacity in this regard. Until we get to that point, we sequence a subset of the positive tests that we run at our own public health lab here in Frankfurt. And we also get samples from certain other laboratories when we have outbreaks in certain settings, like the nursing home outbreak we had in Eastern Kentucky that I talked about last week. So what I want to share with you today is that we now know that in at least 15 counties across the state, we have found these variants, the predominant one being the B.1.1.5, which is the variant that's associated with the United Kingdom. There's also some of the South African variant as well. The national public health experts had said that they thought by springtime, the United Kingdom version, the B.1.1.5 version, could be the predominant strain in the nation because it transmits more easily than the original strains. Now, the reason all of this is important is the same thing I talked to all of you last week about. The vaccines are our exit strategy. The vaccines are the shot of hope that get us out of this mess and get us back to our lives safely and as fully as possible. So it's really important that everybody takes a vaccine as soon as you have the opportunity. And as the governor just shared, opportunity is more abundant now than it has ever been before. And as the federal government expands supply of vaccine to more pharmacies and more federally qualified healthcare centers, and as we then have more resources in the state level to supply other locations over the next 4 to 6 or 8 weeks, it means that it's going to get easier and easier for you to get a vaccine closer to home and from a clinician that you know and you trust, so that if you have questions, you have the opportunity to ask those questions and feel comfortable and secure in getting the vaccine. So back to the variants, what we found in the Eastern Kentucky nursing home is that it precipitously dropped the amount of symptoms people had, even if they had the infection when they were tested. And it also dramatically protected people from going in the hospital and suffering consequences as bad as death. So please, when you have a chance, please get your shot of hope. It's a shot of hope for you individually to keep you safe. It's also a shot of hope for your friends, your family, and everyone you care about, because if we allow this virus to spread too rapidly by not getting vaccinated, it has more and more of an opportunity to mutate and to change. And sheer blind luck will ultimately help the virus to learn how to be more effective by pure random chance. It'll get more effective, and it will still pose a big danger to us. And in some states, they're already beginning to see the uptick of new case counts already. So we really, really can't afford to be cavalier about this. So please get the vaccine as soon as you're able to. And as the governor said, I'll be back, I think, in a little bit to talk a little bit more. So thank you very much. Back to you, Governor.
All right. And to give people an update about the number of these that we have found of these variants of concern in Kentucky, it is currently 41 different cases that we have identified. That includes 1 in Allen County, 5 in Boone, 1 in Bullitt, 1 in Callaway, 4 in Campbell, 1 in Christian, 2 in Fayette, there they are, 2 in Garrett, 8 in Jefferson, 11 in Kenton, 1 in LaRue, Madison, Marshall, Russell, and Warren. All right, again, continuing with vaccines, let's look at Table 1. Pretty exciting. We have now vaccinated 1,319,323 Kentuckians, and that is just about 40% of our adult population. It is really exciting. The pace continues to be a real positive as we look at the numbers for this week. What we see is already, and we've got another 2 days, 115,820 thus far this week. That's going to increase, we believe, significantly by the time we close out the week. But we have now used 93% of all of our first doses that we have, again, with a couple days to go. First and second doses combined, we're now at 82% of everything being used. And that's a great statistic for us because we don't rush the second one because we insist that it gets to the person it's been designated for. So it's good to see that pick up. Also, individuals 70 and up, we believe we've now vaccinated about 70% of that population and continue to push. That's based on estimates of the overall number of people 70 and up. Now to talk a little bit about where that places us with some of our border states and what we see across the country, because I believe we compare favorably to everywhere. Let's go back to Dr. Stack.
Thank you very much, Governor. So on the CDC's website, if you were to Google CDC COVID tracker, you could find the vaccine section, and there they have a map. And that map they update every evening, they say, at 8 o'clock Eastern time. That map shows the number of people vaccinated in the state, the people who've received at least 1 dose of vaccine, the fully vaccinated population. That means people who've received 2 doses of a 2-dose vaccine or 1 of the Johnson & Johnson. It also shows breakdowns. You can change the settings to look at the total population, the percent of the total population, or the percent of people over 16 and up, because those are the ones eligible for vaccination. If you look at those metrics, Kentucky has been and remains, as of my last looking at it just a few minutes ago, the best performing state of all of our 7 border states. So for all the states that we share a border with, we are leading in terms of the number, or the percent rather, of our population who have had at least 1 dose of the vaccine. We're leading in terms of our percent of the population, no matter how you slice it, whether that be the total population, the population 16 or over, or the population, I think it's 65 or older is the senior cutoff that they have. So we have really, really done a great job. I want to thank, we don't get where we are without the help of everyone across the state. I want to thank so many hospitals who've been helpful, so many public health departments, the local health departments who have done so much to reach out into the community and help folks. I want to thank the federally qualified healthcare centers, rural health centers, and now the hundreds of pharmacies, both large chain and also independent pharmacies who are helpful. It's taken really the entire state to get where we are, and we still have medical practices, physician offices, urgent treatment centers. There are more places to get to. The federal government's going to supply dialysis centers directly in the very near future. So there's a lot more work still to be done. But for where we are today, Kentucky, again, is a leader in this regard. Now, I want to make a personal appeal to all of you. Please get the very first vaccine that's available to you. All three of these vaccines are wonderful. I would take any of the three of them, the very first one available. This really is, like I said before, this is our exit strategy. We've got to take advantage of this great benefit that the United States has. There are still countries throughout the world who haven't vaccinated a single person. And as the governor just said, we have nearly 40% of our adult population, when you define adult as 16 and up, already vaccinated as we sit here today. Please, let's not miss this opportunity. This is how we all get safe and everybody can get back to activities. So I'm very proud of the work that all these healthcare providers have done across the state. And I'm very proud and privileged to be a Kentuckian, because I think there's a whole lot of you out there who have risen to the challenge and responded to the call to get your shot of hope when the chance was available. So thank you for all you're doing. We're so close to the finish line. We can't stop before the race is run, though. Please, yourself get vaccinated if you haven't yet. And if you have friends or family, please encourage them to be open to this and go out and take advantage of this opportunity so we can get ourselves all protected and keep ourselves safe. Thank you very much. And Governor, back to you.
Thank you to Dr. Stack. And just as a brief clarification, the 40% of individuals vaccinated is based on 18 and up. It's closer to 37, just north of 37, 16 and up. But there's only one vaccine right now that's available to individuals 16 and up. CDC, I think, goes by 18 in their statistics. Let's look at the demographic breakdown, which we do every Monday, first by age. What you'll see is this used to be a sharper kind of line that went from 70 and up down. That's going to change as more and more vaccine is there, as more individuals 70 and up have already gotten it. We will actually see certain of these other age groups overtake it because there are that many more Kentuckians, say, that are 40 to 49 than maybe 70 and up. So again, right now, this looks the way that it should, with a rollout that was based on age and certain professions. This is how it should look, but it is going to change as we move forward. Gender, we still see a difference. Thus far, 57.5% of all vaccinations have gone to women, 42.5% to men. We continue to watch that. Ethnicity, I think this has ticked up just a bit. 1.6% Hispanic, 98.4% non-Hispanic. And then by race, what we see in this chart is it's about 85.5% white. Black or African-American has now almost reached 5%. Remember, we started off at 4.98%. 1.27% Asian, and the others don't, I think, hit the full percent. Still not where we want to be, but improving. The other is still stubbornly at about 8%. We were working with those that are vaccinated to not just be checking an other box to get out of collecting this information. We think that was happening at least a little bit, but again, not knowing what is in that other could be giving us a slightly unclear picture of the true numbers. But this is the very best we have. If we removed the other from this, then what you'd see is the numbers would look a little bit better. But again, this is based on what people fill out. They include other in the census, so we have included it here. All right, let's look at what again is a good trajectory in cases in the state. Let's look at our stair-stepper chart. I want to say congratulations, Kentucky. You have just had your 11th straight week of declining cases. That is amazing. It's down roughly, this last week, down roughly 400 cases of COVID from the week before. That is wonderful for us. But a word of caution, many other states are seeing their numbers increase. I believe the United States just saw their numbers from last week increase. New York and New Jersey are starting to see a rise. That's what happens if we give up too early, if we don't play out the game, if we quit in the fourth quarter, if we stop wearing our masks, if we roll back the common sense regulations that we are gradually easing and just try to spike the football right now. We cannot do that, and we are already seeing other places that are paying the price for it and or are seeing their cases increase based on the activities of their people. This thing is still dangerous. It's still killing people, and it's going to continue to kill people until we stop it. We have to get enough people vaccinated before the variants come in if we want to avoid another rise in cases here in Kentucky. And we can do that. We just got to keep it up. You know, I was in a number of different places across this weekend. I saw excellent mask usage in Mount Washington and one of the grocery stores. I saw great mask wearing, especially at the event at the African American Heritage Center. We have got to keep this up. We've got to keep this trajectory, this downward trajectory going. Right now, we're a beacon, and how that's happening versus many other places in the United States. Let's continue to try to set the example. Let's show positivity. This may show what a challenge it's going to be moving forward. Our positivity rate was down and down again. And while that's our 11th straight week, look at how close last week or 2 weeks ago and last week were. That means that we at least have indications that we could see cases plateau. I don't think that's necessarily the case, because go back about 4 weeks ago and we saw the same thing, but I think we put in the hard work and we were able to further reduce it. So, for instance, if you're going to go on spring break, and again, we are still suggesting that people do not engage in non-essential travel, but if you're going or if you're already gone, please act like you're here. Wear your mask when you're out, when it's more than just you and your family or small groups that have been vaccinated. Be careful. Let's not mess up getting back to school. Let's not mess up where we are in COVID. So please be careful. Other positive signs, the inpatient census, the number of people in the hospital for COVID continues to decline, though the decline curve may be flattening a bit. We have to continue to watch this. The ICU census, number of people that are fighting for their lives, again, continues to decline, but the slope of the decline is less severe than it has been. And then Kentuckians on a ventilator. That one continuing to decline and more of the downward trend that we have been seeing. Hospital capacity, again, only one region in the red zone, but with plenty of capacity around it. Right now, I have no concern about a lack of healthcare capacity in Kentucky. Those tough steps we took in November, and I know they were tough, meant that we're one of the only states in the nation that has never faced overrunning of our hospitals. Never. There have always been enough room and availability for Kentuckians. There were some close calls where some of our hospitals had to expand where they were treating patients. But to everybody in Kentucky, to our hospitals, good job. Let's make sure that never, ever happens here. All right, going to today's report. Today we're reporting 310 new cases of COVID-19. That's up a little from Monday of last week, but it's lower than the week before that and the week before that. Kentuckians hospitalized and in the ICU, both down. currently on a ventilator, up just a couple. Current positivity rate, 2.89%. That's virtually flat. That's a difference of 1/100th from yesterday. We have 8 red counties. Isn't that incredible? We have just 8 red counties. We are sad to report, though, that we have 11 new deaths, and by new, it means they've come up from our local health departments in that method, and there are no audit deaths to report today. Of these new deaths, and I'm going to read the month that they also occurred. Remember, sometimes they take extra documentation. Sometimes overwhelmed regional EPIs and local health departments. This is when they get them in. So, 58-year-old woman in Bourbon County, we lost. That's a late January death. We lost a 92-year-old woman from Bullock County in mid-March. We lost a 90-year-old man from Garrett County in late January. We lost a 78-year-old man from Jackson in early March. We lost a 38-year-old man from Jefferson County. This is actually back in August, but reported now. Lost an 86-year-old man from Jefferson on Christmas Day. We lost a 73-year-old woman from Johnson County in late February, a 78-year-old woman from McCreary County in mid-February, a 72-year-old man from Eulenburg, first week of March, an 80-year-old man from Shelby County in November, and a 59-year-old man from Spencer in December. Long-term care. Again, these numbers have totally turned around. 3 new residents testing positive, 4 new staff, 1 new death to that total. Again, we're seeing some of the lowest numbers ever. Now, over the weekend, in making sure that we account for every single person we've lost to COVID, making sure that we continually run these audits that other states are doing too, so that we have no unknown soldiers, so that we have the full knowledge of the loss and the substantial loss due to COVID, that everyone's grief is fully recognized. We passed over 6,000 Kentuckians that have died from this epidemic. 6,000. It is staggering. And to recognize that these aren't just 6,000 flags behind the Capitol. And if you walk out there and stand at one end now, it hurts. I mean, how much longer that it's gotten standing on either side. And the amount of death and grief is hard to take. And they're all special individuals. Today, we're honoring the life of Tim Jackson of Prospect, who passed away on March 1st from COVID-19. He was 74 years old. Tim was an all-around great guy. He dedicated his life to others, always serving those in need in his spare time and through his career as an educator. Tim was a coach, teacher, principal, and superintendent before going on to be Secretary of the Cabinet of Families and Children. We spoke to his friend Jim, who called him the ultimate role model. The light of his life was his family. He married his wife Paula in 1968, and together they had 3 children, Paul, Christy, and Shannon, and 7 grandchildren. His family was his priority. His friend said while Tim loved golf, his number one hobby was caring for his grandkids. He was proud and loved them more than anything. If you knew if Tim backed out of a game, it was for a good reason. It was for more time with those kiddos. Today, we lift up Tim's family in prayers and in our hearts. Let us light our homes green. Let us continue to ring those bells at 10 a.m. every morning to show compassion to Paula, their 3 kids, and their grandkids. As I mentioned, this year, this 14 months, this evil virus has taken more than 6,000 Kentuckians. It was just in late January when we crossed 3,000 Kentuckians lost to the virus, and that's when we began planting the flags. To extend this honor in the future, on March 6th, the 1-year anniversary of our very first case I announced the creation of the Team Kentucky COVID-19 Memorial Fund, which will help us develop a permanent memorial to the victims of this war right here on the Capitol grounds. This monument will stand in honor of the Kentuckians we've lost and commemorate the sacrifices that we've all made. It'll stand for the compassion we've shown to each other, our connectedness, the things we did to help get our kids through this, to get our parents and our grandparents through this. Recently, we announced we'd launched a website where Kentuckians can make a donation to the Team Kentucky COVID Memorial Fund. Kentuckians can dedicate a donation to someone they've lost or someone they want to honor. All donations are tax deductible, and donors will receive a receipt for purposes of donating. If there are additional funds remaining and the memorial is fully funded, they'll be used to assist Kentuckians who lost a loved one in COVID in reimbursing a portion of their funeral or burial expenses. To make a donation or obtain more information, visit teamkycovidmemorial.ky.gov. That is teamkycovidmemorial.ky.gov. Soon we will announce an artist call to encourage artists to submit their ideas and proposals for the design of this memorial. This is just one way to remember the loss, to remember every sacrifice, and to make sure we don't forget the very hard lessons we have learned in the midst of this pandemic. All right, we have 6 journalists joining us today. There's apparently other things going on in the Capitol today that have taken others away, but we will start with Tom Latek from Kentucky Today.
Thank you very much, Governor, and good afternoon to you. I know for the last 3 days we've not had any new deaths from the audit. Has that completed? I know it has more than you originally thought. I believe it was 604. We've had considerably more than that. Where does that stand now?
Well, we're going to continue what we're calling the audit until we've fully defeated this virus, because what the audit is it's pulling all death certificates that are out there and determining if, yes, they're a COVID death, and we do this independently from what's coming up from the local health departments. And if it's not up from the local health department, we will go ahead and report it. And for lack of a better term right now, we're going to call that an audit death, even moving potentially either backwards or forwards. This is the process that we had hoped was in place the entire time. And it's one that we need to make sure continues. There are at least a couple hundred cases out there. I think it's right at that don't have enough documentation or have to go through the committee before we can fully confirm that they are a COVID death. We are also going to be taking a look back before this period of time that was certainly overwhelming. To again make sure that every single person is accounted for. So we believe that there will be more in the future as we move forward, but there haven't been any these last days. Now I will say more than 100 have come up from the local health department, but we caught in the audit so that they are not reported as a new death. And I think we will see that moving forward as well. So today's new death group, what's coming up from the local health department, would have been more, but for the work we're already doing. Stu Johnson from WEKU.
Thank you, Governor. Good afternoon. I have 3 quick questions. One is that you mentioned that 40%, roughly upwards of 40% adults have been vaccinated. So when do you envision herd immunity in Kentucky? The second question is about spring break and the students and families going different places. But as far as the risk to bring COVID back when the cases are not what they were in the summer, is there still the risk? And then finally, about the General Assembly and action on the federal stimulus money, do you anticipate that by midnight tomorrow? Any action?
Yeah. So herd immunity, is really a question across the country. People have put it at 70 or 80%. One thing I want to say is while we are really proud of how we're doing in Kentucky, I don't think there's such thing as a Kentucky herd immunity. I hope there is, but I really think we have to get it across the country. In other words, we got to have Tennessee and other border states get to those numbers as well. I actually brought that up on a call with other governors on our on some of our major committees, in that, and there's a lot of comparisons that go on, and we do it too, but we got to get everybody to get there. But I think the numbers we hear more often than not are 70 to 80%. And we certainly want to get there, and we want to rush to get there as fast as we can. Spring break, there certainly still is a risk. We are seeing cases increase in other states. And if you go to a state where they're not wearing masks and they're not engaged in social distancing, and people are piling into the places that have been proven the spreads the most, then you're engaging in riskier activity away from Kentucky than you would have in Kentucky. So certainly the risk increases. And if you're going to go to a different state during spring break, try to act like you're in Kentucky. If you don't, get tested. Maybe wait a couple days before sending your kids back to school. Put them in the virtual option. Just be careful. I mean, I remember when we could trace some of the early cases to even individuals and families that had gone on spring break, how devastated they were that, unintentionally, from making a bad decision that they could spread this virus. We just want to make sure we avoid that. General Assembly had another good conversation about stimulus and stimulus dollars. They've got 2 days. Certainly, this is what I wish they'd focus on, as opposed to overriding some vetoes where we identified just an issue where it won't work, whatever the bill is. And we were hoping that they would, instead of overriding, just fix them. Because I always think the number one thing that legislation should do is work. The question is, are we more interested in being partisan and showing each other who's boss, or actually doing something that works and advances the ball to help Kentuckians? Chad Hedrick from WKYT.
Hi there, Governor. With the CDC director saying today that she has this feeling of impending doom amid a new spike of cases, and then President Biden said today that states should pause any reopening efforts, what is Kentucky's response plan to make sure that this surge doesn't happen here?
Well, it's what we've been doing. I think we have already been being very careful. Any restrictions that have been eased in Kentucky, we have been doing it in steps, incrementally, if you will, to make sure that we can catch an increase or even just a plateau, hopefully in real time. We pledge to continue our mask mandate, which is the number one thing that the president and the CDC are asking for. And while we may continue to gradually ease restrictions, that's the way we're going to do it, step by step, until we get to the finish line of getting enough people vaccinated where these restrictions aren't necessary. And to some of the doubters out there, we are going to get to a point where we don't need to have any COVID restrictions. And I will be the happiest person to not have any of them out there anymore. But until we get there, we got to protect one another, and we're going to keep in what we believe is necessary. And Chad, we're not going to be afraid if we have to increase their severity again because of a spike, we will. Sarah Ladd from the Courier-Journal.
Yes, good afternoon. Thank you. Regarding the Lost Wages Assistance Program, last month you had mentioned the state was talking with FEMA about possible additional funding to pay those who were deemed eligible for the program after funding ran out, and also mentioned the latest relief bill as a possible source of relief. What is the status of those efforts? Thank you.
I need to get you an update on that. I don't have that in front of me, but yes, we were exploring that, and I need to get you that answer. We'll send that to you. Bruce Maples from Kentucky Health News.
Thank you, Governor. We continue to get inquiries from persons concerned about prisoners and their vaccinations, because obviously the prisoners can't isolate or do anything like that to protect themselves, since they are completely dependent on the state for being protected from the virus. What is the state's plan currently to vaccinate the rest of the prisoners?
So to date, we have vaccinated 181 inmates, the majority in 1B, but a few over 60 to use up all the vials that we had on the 1B days. There are 703 inmates in 1C, and there's 3,293 inmates with underlying health conditions. We have had some good news that active cases have declined at the hot spots. The Kentucky State Penitentiary only has 37 active cases, down from 555 on March the 16th. WKCC has 5 active cases today, down from 70 on the 16th. Dr. Stack expects J&J to ship to the Department of Corrections. Right now, the date looks like April 12th is when we will have the amount of J&J to do that. And right now, over 1,200 Department of Corrections staff have been vaccinated. There may be some institutions where we believe we could do Moderna or Pfizer. The challenge is in other institutions, people aren't necessarily there, going in and out of different institutions and or at different times being released. So we believe that the J&J supply is necessary, but the plan is in place. Ryan Van Velzer with WFPL.
Thank you, Governor. First, just a quick point of clarification. When Dr. Stack was speaking earlier about the variant, I believe he said B115. Was he referring to B117, or am I out of the loop there? And then
You're right.
Second point.
It's 117. You're right.
Okay, and then just on that point that you were talking about before, next week or April 6th, Indiana is planning to remove their mask mandate. I believe Tennessee doesn't have a mask mandate. Are you talking with other governors? Are you trying to cooperate about coordination and cooperation to ensure that everyone keeps these protections in place until they're no longer necessary?
I've had conversations with certain governors recently, admittedly not on this topic, but on vaccinations and then on economic recovery. I'm happy to have those conversations, but Ryan, everybody ought to know the importance of wearing a mask by now. And I think everybody ought to believe that we've got to protect one another, especially if we've been vaccinated, until we get to the finish line. So I would certainly encourage any and all of them. But some of these governors had, in the Trump administration, Dr. Birx come directly to them and say, you desperately need a mask mandate. And a couple of them said, no, we're not going to do it. That's to one of the top CDC experts in the nation. And my concern is the politics is back on some of this, getting caught up in broader national politics, just being pushed from a different direction. But it doesn't help any of us. And you're right. Kentuckians are going to be more at risk if Tennesseans are not under a mask mandate, which they haven't been for a while. But Indiana ending theirs is also concerning. Now, what I will say is Governor Holcomb has been flexible at different times in the past, where he has moved a certain direction and then either cases increase or others, and they've at least stopped. So my hope is he hears the president's call and reconsiders. He's a reasonable person. We've had good conversations. This is one I hope he reconsiders, and if I have the opportunity, I'll certainly ask him personally to reconsider. All right, I want to thank everybody for the questions today. Remember, we are still in this fight. One last piece on the Ebola tracking update. There are 15 travelers now that have been in either of those two countries with an Ebola outbreak. We've reached and/or local health departments and talked to 12 of them. They're all low risk. The others are still being worked at being contacted. We don't think that there is a risk there right now. Again, everybody keep it up. 11 straight weeks of decline. That means good, hard work by Kentuckians. Also, great work in showing up to be vaccinated. But let's keep it up. We showed you 4 locations. Let's show them again, where there are a lot of vaccines this week. First time we've said there are openings in Lexington, Louisville, and Frankfort. Go get them. Well, there are openings in Lexington, Louisville, and Frankfort. So go get them. Also, Carter County, King's Daughter Pavilion, anywhere in that area. I think almost 1,000 appointments available right now. This is the time we get it done. This is the time we defeat COVID-19. Please go out and get that vaccine. This week is a little bit different. We are going to get together next on Wednesday And that will be the last update for the week because I'm going to try to take just a couple days off with my family at the end of this week. So everybody be safe. I'll see you Wednesday at 4.